minutes for you, or you are fine?
No, I'm fine.
Because I'm keep playing with you. Okay, Roswana, this is the 3 minutes finish. Okay.
Yeah.
Just
Mhm.
tell me, how did you use the 3 minutes? What's your thoughts? And how did you look at the picture? Just for the learning point of view, and then we'll start the case.
Sorry, I'm really bad. I'm colorblind, so I'm just thinking, is it only redness I'm seeing or anything else in the middle? Uh,
Okay.
I I was a bit of struggling with that, but anyway,
Okay.
it seems a bit of inflammation probably going on. So
Okay.
by looking at the picture and at the age, I was thinking about some obviously eye symptoms and eye possibility, any trauma,
Mm-hmm.
any previous history of bloodshot eye. That's what I was thinking. And then
Excellent.
all the eye symptoms like pain, itching, any
Excellent.
watering,
Mm-hmm.
then foreign body, any visual disturbance.
Mm-hmm.
Then I was thinking about in general, like any headache, any nasal discharge. There are
Mm-hmm.
some eye condition which could happen like on a systemic disease. So I was thinking to ask about
Excellent.
skin, any joint, any
Excellent.
rash, any joint problem.
Excellent. Excellent.
If I'm in
Excellent.
doubt, I might ask about urine symptoms, STI symptoms,
Yes.
but not
Yes.
sure how
Yeah.
much I was able to
Yeah.
cover.
No, that's fine. You did most of the tricks. Okay. Just a couple of things. So when you are looking at the eye,
Mm-hmm,
so if he's not bringing, if the other eye, so most
mm-hmm,
probably is not something related to squint, or you need to compare the both eye together. If they are bringing
mm-hmm.
only one eye, so usually it's not affecting both eyes. So is it squint? You want to compare this and that. So usually, if a case of a squint, or muscle problems or nerve problem, usually we will bring both eye to compare. Okay. So
Okay.
here he bring you one eye, so most probably he's picking up this red points, okay? But then when I'm looking at an eye picture, okay, I'm looking at the skin first, okay? The skin seems to be fine, no vesicles, no rash, nothing can make me, worried about the skin. And then approach to the eyelid because it's important. So look at the eyelashes, and then the lid margin. So you can see the lid margin is not inflamed, okay, not edematous, okay. So most probably this is not conjunctivitis, because conjunctivitis will cause edematous and inflamed eyelid, most probably. Is it stye? I cannot see any stye. Chalazion also, I cannot see any chalazion. So all of these are cases are potentially, you know, to appear, okay. And then, well, you can see then the sclera and then the cornea, so and the iris, okay. So you can see the pupil is fine, not distorted, so this is no problem, iridocyclitis or something related to the uveal tract. Well, the cornea is, you know, is clear and transparent, so, you know, it's not pterygium, because pterygium also, although there is not much to do for the pterygium except, you know, explanation, but, you know, this one of the things is also the cornea is not cloudy, so it's not, you know, like keratitis. You cannot see that there is any inflammation in the cornea. It seems transparent. Okay, and then one of the important things that we need to take care of is the corneoscleral junction. This, you know, this area. Let me try to here. Yeah, this area, corneoscleral junction. You can see it's clear. Yeah, it's not inflamed. There is no blood vessel. You can see there is clear cut. See all of this red, 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 and then coming near the cornea, and then it's white. Okay, it's not red. So most probably this is something not in the sclera. Okay, so this most probably the redness is coming from, you know, either the conjunctiva, either the episclera. Okay, so because we don't have corneal, you know, we don't have corneal coverage of conjunctiva, you know that.
Sorry, can you explain that a bit more?
Yeah, so the
Episcleritis and
conjunctiva,
scleritis.
yeah, so the conjunctiva is covering all your all the white of the eye, the eyeball, okay, but coming on the cornea, and it will stop, it will not continue. Otherwise, otherwise you will see blood vessels. You will not see. You will not see. You know, you will not be able to see. So the cornea should be clear. No blood vessel for the cornea. Actually, the oxygen for the cornea is coming from the aqueous humor. It is coming from the fluid of the eye. So the cornea are not vascularized. So the conjunctiva is not covering the cornea. And actually, if the cornea, if the blood vessels of the cornea approach to the, if the blood vessel of the sclera or the conjunctiva approach the cornea, this is pterygium. Okay, and then, you know, and this you need to refer. So, is it clear what I'm saying or not?
Yeah.
Okay.
You said pterygium,
So,
if it is approaching up to cornea, then it would be
yeah,
reference criteria.
yeah,
If it is not,
yeah.
then conservative.
Yeah, conservative, yeah. Okay. So, and actually, if it's reaching the central of the cornea, because most probably if it's reaching the peripheral of the cornea, the eye doctor, the ophthalmologist will not do anything. Okay. So if the corneoscleral junction is affected, you have redness there, then you can think about, you know, scleritis, episcleritis, or keratitis, because the inflammation is reaching around the cornea. Okay. So, from the picture here, what would be your differential with only, you know, redness around the eye, and it's not diffused redness? Any differential will you would be able to put in your, you know, just
Not
from
at the
looking at the
I'm just
picture?
thinking.
So
I
from
was
the
thinking
picture is
honestly,
only,
like
yeah.
scleritis, episcleritis, and
Okay, so
red
that's
short
fine.
eye.
Yeah, so scleritis, episcleritis, conjunctivitis, but usually conjunctivitis will be generalized, generalized inflammation, not localized. So from the picture here alone, you can just predict that this is either scleritis or episcleritis. Okay. Yeah. The other thing, one of the differential between conjunctivitis and episcleritis, we'll talk when we discuss the case. Okay. The other thing that will come to your eye here. Where is the address?
Saying farmland.
Yeah, and here what? TR.
Dear.
Well, you know what TR is?
No.
Transient resident. Okay, so
Oh,
also this
okay.
is an important bit. Okay, transient
Okay.
resident farmland.
Mhm,
So maybe you need to ask more about that. Why his transit isn't what, job
mhm,
and so all of that you can just can go through your mind only
mhm.
from looking at the picture. Yeah.
Okay, yeah.
Yeah, and having some, information there. So this is how you will utilize the 3 minutes. Okay.
Mm.
Yeah.
Yeah,
I just
sure.
added 2 points. I didn't add a lot. So I add for you 2 points. Or what you already said is more than enough. So shall we go through
Yeah, sure.
the case? Yeah.
Yeah.
Sure. Yeah. Go ahead.
Hi, Sam. It's me, Rizwana, one of the doctors from GP surgery. Could you please confirm your age?
Yeah, I'm 45, doctor. Thank you for calling.
Okay. Thank you for sending your picture. I believe our today's consultation is to discuss your eye issue. Am I right?
Yes, doctor. Yeah, to be honest, I'm not sure what's happening to my eye. It has been
Mhm.
like that for 3 months.
Okay.
There's not a big bother for me, but I don't know why it's becoming red every now and then. I
Mm-hmm.
bought some eye drops from Boots.
Mm-hmm.
It's working. It's making the redness go, but then after
Mm-hmm.
1 2 days, it's coming back again.
Okay.
So I'm not sure what to do. It's just, should I be worried? I'm not sure.
Mm-hmm. Mm-hmm. Don't worry. We will figure it out together. What's the best way to move it forward? Is that okay?
Yeah, sure, doctor.
Okay. So you told me that your symptoms is going on for 3 months. That's the redness. It comes and goes. Anything else that you could tell me?
Like what, doctor?
Mhm. How did it start? Did it start suddenly or gradually?
But to be honest, I think it's just appear,
Mm-hmm.
without any, even I didn't feel any pain or something.
Mm-hmm.
Just
Okay. So
I was looking at the mirror
mhm.
shaving my beard,
Okay.
and then
Mm-hmm.
suddenly I find this redness.
Okay. So sometimes injury could cause that, but you could not remember any injury before it
No,
started.
no, I didn't hit it, to be honest.
Okay. Mm-hmm.
Even I'm cautious about that.
Mm-hmm.
Nowadays I'm working as a farmer and I'm helping in the
Mm-hmm.
farm, but
Mm-hmm.
I can't recognize, I can't recall that I had anything entered to it. No, I don't think so.
Okay. Okay. Thank you for answering that. I was going to ask you any foreign body that you could think of, but you said no.
No, no.
Okay. Okay. Any pain in your eye?
Well, it's not pain, but I'm seeing, it's like a little bit of discomfort and sometimes becoming watery, sometimes not always, but other
Mm-hmm.
than that, no.
Mm-hmm. Mm-hmm. Anything you have noticed that's triggering this redness, as an example, sunlight or anything else?
No, to be honest, I can't make any association, to be honest, doctor.
Mm-hmm. I could see that you only sent me right eye picture. I'm thinking that you don't have these similar symptoms on your left eye. Am I right?
Well, the left eye is more or less the same, sometimes coming to become red, sometimes not. But,
Okay, okay. So you have got
yeah.
the similar symptoms on the left eye as well. Okay.
Yeah, it's
And
coming in the two eyes, so but there is no difference. That's why I send only
mm,
one picture. Sorry if I'm,
okay. No, no, no.
yeah.
Thank you for clarifying that. Have you noticed any sticky discharge?
No?
Mm-hmm. I'm asking you all those questions because it's going to help me to better understand what's going on. Okay.
Okay, sure.
Any itchiness that you have noticed?
No, no.
Okay. Any headache?
No, no headache at all, doctor.
Mm-hmm. Any changes in your vision?
No, well, it's just when it become watery, sometimes, I need just to wipe
Mm-hmm.
it several times. But
Mm-hmm.
no, my vision is
Mm-hmm.
fine.
Okay. Okay. Do you have any form of allergy? As an example, hay fever?
No,
Okay. Have you noticed any skin rash?
no, also no skin
Mm-hmm.
rash.
Okay. There are some other condition which could affect the eye. As an example, if anyone is having any joint pain, does it happen to you?
Well, yeah, doctor. Well, yeah, to be honest, but I didn't think that it's related. Yeah, my hands, I had my both hands are, becoming nagging a little bit the last few months. But I
Mm-hmm.
thought because because I'm, my farm
Mm-hmm.
working is new,
Mm-hmm.
I'm
Mm-hmm.
living, I'm in one of the traveler community, and usually in the
Okay.
summertime we're coming to the big farm.
Mm. Mm-hmm.
So I thought because I start to become manual, then that's why my
Okay.
hand is
Mm-hmm.
painful. But yes,
Mm-hmm.
I have both of my hands are hurting me, to be honest, doctor.
Okay. And you said for a few months. Have you noticed any stiffness?
Yeah, it's always stiff, especially in the
Mm-hmm.
morning, but it's all
Mm-hmm.
over the day also. But
Mm-hmm.
more in the morning, especially the first hour. And then when I
Okay.
start to work a little bit, it's
Mm.
fine, but
Mm-hmm.
but it's not as it was, to be honest. Yeah.
Okay. Oh, I'm sorry to hear that. It sounds quite bothering you, this stiffness. How long does it usually last in the morning?
Well, it's always there, but the worst in the first hour or first 1.5 hour.
Mm-hmm. Okay. And you said about farming, is it a new profession or you are doing that for quite some time?
No, doctor, as I told you, I'm from traveler community. So
Mm-hmm.
in the summertime, we are coming
Mm-hmm.
to work in the farms because they are paying us good. And
Okay.
then in the winter
Okay.
time, we are just doing, some
Mm-hmm.
shows and dancing shows.
Mm-hmm.
Yeah.
Mm. Okay. So I could see that you are registered with our GP surgery as a temporary resident.
Yeah, doctor. Yeah.
Mm-hmm. If you don't mind me asking, how long you will be here with us?
Well, to be honest, summer is approaching to end, so the season
Mm-hmm.
is will end soon. I'm not sure.
Mm-hmm. Mm-hmm.
Perhaps month or something. I'm not sure.
Mm-hmm. Okay. Who else lives with you?
Well, my family,
Okay.
my wife and my
Mm-hmm.
two
Mm-hmm.
daughters.
Okay. So at the beginning, you told me that you were not quite sure what's going on with your eye symptoms, but
Mhm.
anything in your mind that I could do today for you?
Well, maybe if you can give me better eye drops.
Mm-hmm. Okay. Oh, you told me at one point you have used eye drops.
Yeah.
What was the content of the eye drop? Do you know?
Well, I'm not sure, but when I asked the pharmacist, he told me something to lubricate my eye and also something to decrease the caliber of the blood vessel or something like that. I didn't get it, to be honest, but it's
Mm-hmm.
working, but then
Mm-hmm.
after 2 3 hours, then it will return again. So I'm not sure.
Okay, okay. Don't worry, Sam. I'm going to discuss to you now, like what we could do going forward. So after talking to you and having a look at your eye picture, I'm thinking there is a condition we called rheumatoid arthritis. That's usually joint-related issues. It's causing painful joint and stiffness of the joint. So this condition sometimes could involve the eye as well, causing a bit of redness and watery eye. Uh, is it clear so far?
Little bit. So this rheumatoid arthritis,
Mm-hmm.
so it's affecting
Mm-hmm.
my joint, you mean, and my
So
eye.
this condition usually affects the joint, but
Okay.
it could represent in different ways. As an example, it commonly involves the eye. This
Okay.
condition we call some inflammation going on the white part of the eye. We call it like episcleritis. The reason I'm calling it episcleritis because you don't have much pain other than a bit of discomfort. Oh, sorry, is
Okay.
it clear so far? I'm
Yeah, yeah, yeah. No, no,
telling
it's
you a lot of
fine.
things in
No,
one go.
no, no. It does make sense. Thank you very much.
Mhm.
Thank you. Yeah.
How about if I'm bringing you to GP surgery? I would like to do, obviously, I would like to check your blood pressure. I would like to
Hmm.
check your heart rate. I would like to examine your eye and particularly your hand joints just to
Hmm.
see how, if it is tender for you, if there is any swelling that I could see. Does it sound good plan as a starting
Yes,
point?
yes, yes, yes. Sure,
Okay.
doctor.
Okay. So your hand pain is going on for quite some time. Did you try any pain medication?
Well, I took only paracetamol, and
Mm-hmm.
it's helping a little bit. Yeah.
Mm-hmm. Okay. So it would be worth it to do some blood test. Specifically, I would like to see the inflammatory markers because the condition I'm talking now, it could increase the inflammatory markers in the body. Okay.
Okay,
At the
okay.
same time, we could do check some general test like in case you are anemic or not, your kidney function, your kidney function, liver function. It would be worth it to make sure that you are not diabetic and your cholesterol level. It's as a part of general health assessment as
Okay,
well.
yeah, thank you,
Okay.
thank you being thorough. Yeah, doctor, no
Okay.
problem.
Any questions so far?
No, doctor, no, doctor, I'm
Okay.
fine. Yeah.
So, likely you addressed, like, obviously, farming work could cause this hand pain as well. But as you said, the stiffness is lasting quite longer and
Mhm.
it's going on for few months. I'm thinking to do a referral to a specific, a specialist team called rheumatologist. They are bone and joint specialist. Okay.
Okay, and what they will do exactly, doctor?
Mhm. So, the condition I'm thinking, rheumatoid arthritis, that's I told you. So, this
Hmm.
condition sometimes could affect the bone. It could cause some lumpiness on the bone, or the pain might get worse. So, they have got some medication to prevent all those bone changes. How
Okay.
does that sound to you so far?
Well, yes, but I don't feel there's problem in my bone. You mean,
Mhm. I
okay.
meant the joint changes.
Oh, okay. The
So
joints. Yeah. You mean, okay.
yeah,
Yeah, sure. Okay, doctor.
Sam, I'm
Yeah.
just thinking, you said you will be here for a month. How we can move it forward? Any idea?
Well, I'm not
Because
sure, doctor. What
Mhm,
you think? I'm
mhm.
not sure.
So
I
ideally,
mean, when usually will refer me,
mhm,
the NHS, it
mhm,
will take ages, so I'm not sure I
yeah.
will be. What you think?
So ideally, if this sorts of like um, if anyone present after 3 months of having this hand joint pain, then usually they see pretty quickly. They will see you in 3 days' time. Do you think you will be able to manage that?
Well, yeah, well, for 3 days I'm here. Yeah, I
Yeah.
will be there. No
Yeah.
problem,
So
doctor.
that's
Yeah.
going to be urgent referral, okay?
Okay.
And I would like to do a catch up with you after the rheumatology appointment just to know what's happening. And if they establish that it's rheumatoid arthritis, in that case, we need to talk about some long term management. We both could discuss, in case if you are moving from here, still how we could do a better management. Is that okay
Yeah,
for you?
yeah, doctor, sure. No problem
Mhm.
at all. Yeah.
Any
Yeah.
questions for me so far?
No, if there's anything I should take care of.
Um, it would be always good, like in case if at any point you develop any significant, like quite bad joint pain and it's becoming red, to seek some help.
Yeah, sure.
Thank you.
Yeah. How you think? Hello?
I could not remember which joint pain is causing eye symptoms. I got a bit of
No, actually you did
is
fine.
it.
You connect the things. Yeah, I believe you had rheumatoid arthritis case presented with episcleritis. So I think you did fine. It's a long case, multiple system affection, eye, joint, and then referral. And yeah, so I think you did well.
I got a
Okay,
bit of
just a
like
few
which
tweaks. Yeah,
condition
sure.
is causing which like ankylosing spondylitis is causing something, probably iritis or something. So I got a bit of muddled up with all
Yeah,
those
but
things.
ankylosing spondylitis will affect the central spine, so the central joints. Yeah,
Yeah.
rarely can affect peripheral joint, but very rare.
Mhm.
Okay, so it mainly will cause stiffness in the back and and the pelvic
Mhm.
area and also chest, neck sometimes. Yeah, will not cause pain in the peripheral joint. So peripheral small joint
Okay.
as rheumatoid arthritis still prove otherwise.
Mhm.
Okay, or osteoarthritis, but from the symptoms, he told you more than a month. And then if you inquire about the which joint exactly, so yeah, he will tell you it's in the joint of the fingers and also joint of the hand with the wrist. So
Mhm.
osteoarthritis will affect mostly the interphalangeal joints, but metacarpophalangeal joint and wrist joint will be affected in the rheumatoid arthritis. Okay.
Okay.
So yeah, so no, I think you did fine. It's just the fine tweak is when you ask about Yeah, open question is fine. You said the open question, can you, take me from where it started, but then you want to ask another open question, then you said anything else. Well, anything else, he will not reply you. You need to specify what you are asking
Mm-hmm.
about, okay? So, don't, that's why when you ask me anything else, I just close it, like what, doctor?
Mm-hmm.
Okay, so if you want to
Mm-hmm.
ask another open question, how you would ask?
Um,
For example. So you want to ask about about his general health. You want to ask about other parts of the body. So how you would ask?
I'm not sure, Salim.
Yeah. So you said okay. You said that your eye is becoming red. Did you notice any other changes in your body? Like any
Okay.
other rashes, any other, and you can combine them. So any other
Mm-hmm.
rashes, any joint pain, you can combine them together. If the case is long, you can
Mm-hmm.
combine them together and see, and see how he will reply. Okay. But you
Mm-hmm.
need to mention something. Don't say anything else, okay?
Okay.
Because it's open, but
Mm-hmm.
doesn't mean something, okay, for the patient. He will not answer you, okay? You need to
Mm-hmm.
specify.
Mm-hmm.
And then anything else can increase it. Well, just did you notice anything brought it up, anything making it worse, rather than anything
Mm-hmm.
else can increase it? So
Okay.
just try to decrease the wording. Other
Mm-hmm.
than that, to be
Yeah, sure.
honest, and the data gathering was for me, I think it was excellent. You ask about the vision, you ask maybe, and you ask about pain, okay, you ask about the other system. You ask about the skin. You ask about the joints, but you already said in the 3 minutes, but you forgot. Okay, so about STIs. Okay, you may ask him.
Mm-hmm.
They're not
Mm-hmm.
sending discharge, or because you don't know. Maybe it's reactive arthritis, isn't it?
Honestly,
Secondary
I was
to
about to,
STI.
and
Yeah,
I was
secondary
about
to
to, but then
STI. So yeah, if you find
it's
something
important. Yeah.
positive, yeah,
Mm-hmm.
then don't miss the other things,
Mm-hmm.
because you
Mm-hmm.
can be STI and he's coming with reactive arthritis, and as
Yeah.
well as eye symptoms. And please, 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 any patient with eye symptoms, yeah, trauma, you did ask. Don't forget lenses, okay? His lens, whether he's
Okay.
using lenses or not, or if he's swimming in rivers, or swimming in the beach, okay, or swimming in swimming pools, okay, because swimming pools can have fungal infection and candida infection, and can spread the candida or even E. coli to the eye, same as
Mm.
parasite. Here there is no much parasite in the UK, but can the the river water can spread some infections, okay, if the river water are contaminated. So yeah, ask about swimming, ask about lenses, and ask about trauma. Differential, you did some differential. Yeah, I think the case was difficult, so he was not very comfortable in nominating multiple differential, but it's fine. I felt the data gathering was sufficient, to be honest. Okay.
Mhm.
Coming back to the ice, you ask him. I don't think you ask about what he think it is, okay, but you did ask what his expectation is, and I didn't hear the concern, isn't it? Did you ask
Oh,
about concern? I didn't
I
hear it.
missed concerns. I
Maybe,
did not
yeah.
ask about idea. The
Mm,
reason is initially you said I don't know what it is
okay.
exactly,
So,
but
yeah.
concerns, yeah, I missed the concerns. Yeah.
Okay, okay. So, yeah, then so just maybe you can tell him, okay, I have some ideas what it might be causing it. You did say that you are not, there is nothing
Mhm.
specifically in the might be causing it. Is that the case, isn't it? Or
Mhm.
or you want to add anything? Just try to acknowledge his ideas
Mm.
again. Yeah, even
Sure.
if he said I don't have ideas, if you have time, just to try to acknowledge it, okay?
Sure.
I have some ideas what might causing it, and I hear that you don't have specific ideas, but coming back that you're having hand pains and hand joints pain, do you think that's related or not? So try to ask it in indirect way, just to let
Mhm.
the examiner hear it, okay?
Sure.
concern. And then I think one thing was needed to be asked is the family history and the in the psychosocial, because the psychosocial I heard on, yeah, I already volunteered what I'm working, and perhaps you asked the things twice in the working, isn't it? Because I told you I'm in a traveler community. I'm working in the farm from 3 months ago, and then you said why you are TR, something like so. So I already informed you about this bit, and you ask it again. Okay, so just be aware about repetition. I know it's not an easy, okay, because it's not familiar. Transient resident traveler community is not a familiar topic for most of us, okay. But if you are working in an area where there is a lot of farms, you will have some encounter with the traveler communities. um Perhaps I didn't hear if he's taking maybe, is it cannabis, okay, alcohol, smoking, because red eye can be related to cannabis. The smoking can make irritation to the eye. Perhaps also that's maybe, if you had, and actually you had time, to be honest, you finished the case in 20 minutes. You had some 20 seconds maybe left at the end. So you could add this simple question, in the psychosocial, but I don't think it will make a big difference in the total mark. Okay. Management, the rheumatoid arthritis explanation. Yeah, I get the connection. You tell it's connected, how the eye is connected to the joint symptoms, but I didn't get sufficient, I think, information about what is rheumatoid arthritis. Okay. If you want to rephrase, because also you said bones, you didn't say joint. If you remember, I pick it up. So I told you bone,
Yes,
my
yeah.
bone is not, yeah. So if you want to try to rephrase it, how you would be able to phrase it, do you think?
So it's a condition which affects the joint. It causes
Hmm.
inflammation of the joint. Joint
Hmm.
becomes painful,
Hmm.
swelling, and stiffness.
Okay. Yeah, and as well as affecting the eye. And then, however, there is a lot of things, there is a lot of help and support we can do it for you, okay? Or it's controllable condition, and there is a lot of things that we can do to control it, okay? Y- Yeah, put some positivity in the diagnosis, so the patient will not be scared, because if I say, oh, inflammation in my joint, affecting the joint, I'm manual worker, so would the joint be destructed, or what will happen to my joint? So then I will be worried by then, okay? So just tell them it's controllable condition. There is a lot of support we can do. Yeah.
Yes, sure.
Does that make sense? Yeah.
Definitely.
And then you said eye examination, excellent. Blood tests, yeah, very excellent. And you tell him that you will make a rapid referral, okay? And because the symptoms are um, around 3 months, then you said it will be urgent within 3 days. That's excellent. You know what is the idea behind the 3 month windows? Why, if the patient, for small joints for sure, and multiple joint affection is important to do rapid referral, urgent referral. But then why, if the patient, having the symptoms in the 3 month period, windows, so if it's more than 3 months, you need to refer him also urgently. Uh, are you aware why? Which called the window period of rheumatoid arthritis.
I'm not sure. Is it to prevent the complication of the disease?
Two things. So the study find that within 3 months, if you start the medication, the rheumatic drug medication, it so the response to monotherapy within, if you start the treatment in the first 3 months, will be better. And if you started more than after 3 months, usually the monotherapy will not be enough. So you need combination therapy to control the disease. So, and the other thing, within 3 months, already damage will be on the joint and will become irreversible. But if you start the treatment within the 3 months, then you will prevent the irreversible damage. Okay?
Mm-hmm.
Yeah. The other thing
Yeah.
I may like to it's not like it's not like major missing point, but you may tell him I would ask also for the X-ray, okay? Because actually, yeah, we will refer to rheumatology, but we
Mm-hmm.
don't know that it will be 3 days or not. Usually, it will take more than that.
Mm-hmm.
Yeah, you don't wait for the blood test to refer. You will do the referral before the blood test, yeah. But also, you may ask for hand X-ray, okay?
Mm-hmm.
Most probably the
Yeah, sure.
radiology will fight for it. He will say, no, I will not do it. But clinically, it's indicated to do an X-ray of the hand to see if there is any changes. So you can defend that. Okay.
Sure.
Um. Yeah. No, I'm happy. Yeah. Well done. Okay. Well done. Really well done.
Thank you.
Okay. Yeah. Just two small points regarding the rheumatoid arthritis. Um, It's just, yeah. So this algorithm is showing, the red painful, the red eye. So if it's red painful eye, you will need to do an urgent referral for same day referral to the ophthalmology. And then if it's red non-painful eye, then you can sit and think about it. Okay, if it's focal erythema, then it can be episcleritis like this case. But if it's diffuse erythema and congestion, then it can be, one of two things. If there is no discharge, can be subconjunctival hemorrhage. But if there is discharge, you can think about the conjunctivitis and then, blepharitis and dry eye. If it's painful eye, okay, yeah, you will do the referral, but it doesn't mean that you don't want to ask about what it might be, because it can be acute glaucoma, it can be keratitis, or or corneal abrasion. So still it might appear somehow in the exam. Okay, but so also to be familiarized by these topics is important. Okay, and the relation, if you have acute painful eye and the driving. Okay, so Dr. Rizwana, so how, if this patient say, for example, have iritis or iridocyclitis, and then he say, oh, I don't have anyone, and I want, you will refer him now to the eye casualty, and then he told you, I will drive. How you would answer him? So if
He should
he's
not be
driving,
driving.
yeah, so how you will tell him, okay, well, doctor, but I don't have anyone to drive me.
In that case, would you be able to book a taxi for you
Yeah, or better option, because taxi usually is expensive.
or public transport?
Okay, maybe he will not be able to go to the public, to the bus station. What else can pick him from home, and I'll be cheaper option.
I'm not sure because it's
Community
not something
car.
like emergency. Okay,
Community car,
community
the
car.
community car is there. So usually
Mhm.
each clinic would have a number of the community cars, which are, voluntary service. The people are, providing their own cars to drive, the patient to, to the any clinic appointment or even emergency, or. So he can use the community car. Okay. Um,
Sorry,
yeah.
is it the GP surgery is arranging that community car?
Yeah, well, yeah, some GP surgery will be kind enough, and they will, they can call for you the community car. It's not an obligation, because they can just give you the number and read it. But I'm suspecting if you have iridocyclitis, okay, or keratitis, he will have difficulty even in dialing the phone. So
Mhm.
yeah, so the community car, the receptionist can arrange community car. They can call the community car for him. Okay.
And the patient
Yeah.
needs to pay or it's free?
No, no, it's to pay, I think, like, 20p or something per mile, it's very
Okay,
cheap amount to pay. It will be cheaper than taxi, okay?
okay.
The other thing, so if this patient, and he's the traveler, so if this patient will travel, okay, they are traveling to Manchester after, 2 weeks, so he will not be available. So how you would approach that?
Is it the rheumatoid arthritis patient you were talking about?
Yeah, yeah,
In that case, I could say like the rheumatologist team ideally needs to see you pretty quickly.
okay.
So
But
if
then
like within 2 weeks
say,
we are
yeah.
able to. If
Yeah.
within 2 weeks the rheumatologist already seen you, then
Mhm.
they will give a plan. So wherever you are going, if you just let us know the area and the
Okay.
hospital name, we could do write to the hospital rheumatology
Okay.
team. We could attach
Okay.
the letter from the rheumatology local area.
Okay.
Also, when you will register yourself with the local GP, if you share their email address or the surgery name, we could send all of your information to them as well.
Okay, okay, that's good. Yeah, so the area that he will go to. Okay, so if this patient, working in the farm, and usually there is no, you know, there you cannot contact him through the phone, or there is a problem with the post. So
Mhm.
how the surgery could help him in something like that? No.
If you could drop any like neighbors or anyone else number or your friend's
Yeah.
number so that
Yeah,
we could
there's
communicate
yeah,
with that
yeah,
person,
yeah, that can be, or we can,
or
the
we,
surgery itself can get the
yeah.
letter for him, and
Mhm.
and you tell him to come, say every 2 weeks or something, to come and ask
Mhm.
and see how the things is. Okay,
Yeah, sure.
that does make sense.
Definitely. Yeah.
Yeah, yeah,
Yeah.
yeah. I think these are most of the things that. So if we say the other case scenarios, okay, so subconjunctival hemorrhage, okay, you need to check the blood pressure, okay, check also if there is any trauma or not, and head trauma, please, because the skull base fracture can present with subconjunctival hemorrhage. So this is something also you need to keep it in mind. Bacterial conjunctivitis, again, you need to ask about the joint affection or an STIs. Okay, uh, blepharitis, in the picture you will be able to see that there is inflammation in the eyelid. And blepharitis also, always try to so to exclude seborrheic dermatitis with the blepharitis, because blepharitis can be one of the symptoms of the seborrheic dermatitis. Ask about the scalp, dandruff, and then acne. So, these things can be connected together to form a case. Dry eyes, also rheumatoid arthritis can present with dry eye. Okay, so Sjogren syndrome is one of the things. So also dry eye can be connected to rheumatoid arthritis. I think viral and allergic conjunctivitis is, if it's an easy to manage, difficult to try to find a trick on them. So unless you will the questionings, which is trauma eye, and also contact lenses. Coming to the urgent referral one, so keratitis. Um, yeah, so keratitis can be connected to herpes zoster infection, herpes simplex infection. So also can bring like skin rash and of herpes simplex or herpes zoster, and then the patient have eye pain. So you can both of them connected together, so you will know where you will refer exactly. Corneal abrasion, there will be history of trauma. I don't think it's will be that difficult. Glaucoma, so usually if the patient will be in dark room, and when he go to light, he will have the pain and the halos around the light. Okay, scleritis, the pain for sure. Okay, and scleritis is super emergency. He need to go urgently in the same day. Uveitis, iris, endophthalmitis, it's difficult to come as yeah as initial presentation in the GP. Usually they are known to the eye clinic, and there is complication from a surgery or chronic disease that usually known with the eye doctors. Yeah, so this is rapid revision for the red eye. Episcleritis, usually self-limiting disease with simple, over-the-counter eye drops should improve, and simple analgesia. If it's recurrent and persistent, then you need to think about autoimmune diseases, okay, and systemic diseases, okay. This is just a simple differentiation between the episcleritis and the scleritis. And here, the shape of the blood vessels in different diseases. So in conjunctivitis, usually it will be generalized redness, and the blood vessel will be more tortuous. In scleritis and episcleritis, the blood vessel will be more straight. Okay. Also difficult, to differentiate only with the picture. You need to have the clinical context as well. But in conjunctivitis, the iridoscleral junction or ciliary injections are present, but in conjunctivitis are absent. The treatment, okay, and this is what we talk about rheumatoid arthritis. Just a simple thing that if so don't wait. If you are suspecting rheumatoid arthritis for small joints, don't wait until the blood results. You do the referral, because the patient need to be seen urgently. And the other thing, that sometimes the blood test will be negative. Okay, even the rheumatoid factor or anti-CCP can be negative, but still the patient can have rheumatoid arthritis. So if you suspect, refer. Yeah, and these are the most of the things that we talk about. Yeah, if a case came, so Rizwana, are still here, Dr. Rizwana?
Yes, I am.
Yeah, so if a case coming as as a follow-up, okay, or he already have rheumatoid arthritis, okay, and he's coming with query flares, okay, and is coming to you. So what sort of advices you will give? So he is already in MDR, so okay, and is taking, say, methotrexate or taking whatever he's taking, and then coming with a flare, and the pain is much. What sort of advices you may provide him with?
So is it in terms of medication you meant?
Yeah, medication, or even or even lifestyle. What you will tell him? What advices? How he can control the pain and the swelling, and how he will take the things further? Does you need to inform the specialist about the flare? Does he not? Usually, such cases, because of the presence of the rheumatoid specialist nurses, and usually the patient already known to them, usually they are contacting the specialist nurses directly without and bypassing the GP. But say, for example, this patient came to you, for any reason, okay, new patient, or and you don't have any information about him and his treatment plan. So how you would proceed for that?
So if patient is already on DMARDs and having a
Okay.
flare-up,
Mhm.
different pain medication we could offer them. As an example,
Mhm.
like simple inflammation, joint inflammation, could
Okay.
try with NSAIDs.
Okay.
If patient does not want, or kidney function test is quite poor,
Mhm.
as patient is already established, we could give a short course of steroid,
Yeah, okay.
and then
Okay, go ahead. Yeah, sorry.
and
Go
then
ahead.
I would say I would like to repeat the bloods, because just to see how is the inflammatory markers at the moment, and at the
Mhm.
same time I could liaise with rheumatology team by
Yeah,
saying that
excellent.
you have a
Yeah,
flare up.
yeah, yeah. This is important. Why? Why it's important the rheumatology team to know that this patient had a flare up, although you can just treat it with with the steroid. Okay, so you give
Yes,
him
so
the painkillers and this, and still you can is not responding, and you will give him a steroid, and mostly he will respond. So why they need to know about that?
they might need to change on the regular medication.
Yeah, yeah. So because the control of the disease, okay, will depend on the number of the flare-ups. So they can step up or step down the MDAR. Yeah, yeah. That's this how you can approach the case, and why the patient need to know that they need to know, the specialists need to know about that flare-up. Is not just only steroids. Okay.
Mhm. Yeah, sure.
So, and usually, don't forget the heat and cold therapy, okay? Heat and cold, this will help with the decrease of the inflammation. And type of steroid also is different. So usually if it's single joint, they can give him intra-articular injection. If multiple joints, usually they prefer the IM injection rather than the oral prednisolone, because IM usually it will be single dose, and it will control. So pulse steroid IM, either methylprednisolone or any other stronger steroid. The doses of the prednisolone orally, it depends on how many weeks you will decide to give him. So if you will decide, so every week by 5 mg prednisolone. So if you will give him course of 2 weeks, you will start 10 mg and subtract 5 mg with the subsequent weeks until it's nil. And if it's 3 weeks, you will start 15, 4 weeks, you will start 20, and then gradually withdraw it by 5 mg per week to drop down. Okay. If case of rheumatoid arthritis came as a follow-up, okay, or what is the follow-up protocol that you need, to follow in the patient? What is the important thing in your annual review for the rheumatoid arthritis?
So rheumatoid arthritis could cause high cholesterol
Okay,
and all
so
those things. So we need
cardiovascular
to
risk, yeah, so
cardiovascular risk
cardiovascular risk,
assessment
yeah,
as an example, but
yeah,
blood pressure, then we need to check body
yeah,
weight,
yeah,
and then BMI, I meant,
yeah,
and then HbA1c yearly,
yeah,
lipid profile
yeah,
yearly,
yeah,
and
excellent.
all those kidney function tests, liver function, all those
Yes,
things.
yes, yes, that's excellent. And don't forget the ACR is part of the cardiovascular risk, okay? ACR, okay? It's
Yes.
kidney risk and cardiovascular risk. And then also osteoporosis risk, okay? Because the bone are becoming any chronic inflammatory state will cause osteoporosis. So in chronic inflammatory state, as it causes cardiovascular risk, it will cause osteoporotic risk as well as. And the other thing with the chronic disease is the mental health. Don't forget mental health and the functional impact. Okay.
Yeah,
And
sure.
an additional point to be added for rheumatoid or rheumatological disease is the non-melanoma skin cancer. Okay, because they are more prone to develop basal cell carcinoma and squamous cell carcinoma. So just in the review, just tell them if you find any lesion in your skin and looks suspicious, don't ignore. Please come early so we can tackle it. Okay.
Yeah.
Immunization, pneumococcal vaccine, influenza vaccine, HCV, COVID vaccine, and Hep B vaccine, one of the things that we need to emphasize on. And then for
Yeah.
sure, any chronic disease, the compliance, treatment compliance, okay? This is if a case of rheumatoid arthritis follow-up, for example, came in anyhow. So you need to cover these points, okay?
Sure.
Yep. Yeah, and these are the referral. Yeah, we already discussed most of that. I don't think we need to repeat. Yeah, well done. Yeah, wish you the best.
Thank you.
Keep the track moving. Yeah, I'm happy. Yeah,
Thank
I'm
you.
happy with you. No problem. Do you have any question or any of the other doctor have any question regarding this case before we stop the recording? No?
Sorry, Salim, just
Go
one
ahead.
question. I'm just
Yeah,
thinking
yeah.
in case like ankylosing spondylitis came back like iritis or something, how
Mhm.
to say iritis to the patient, how to explain,
Oh, okay.
or
So
uveitis.
I will tell you. So the color bit of the eye is inflamed. Okay. So the white bit is the sclera. Okay. Then the color bit of your eye, which is the iris, is inflamed. Okay. So this is what the patient is will understand. So the colored bit of your eye is inflamed, and this is an urgent case. We need to refer you to be seen urgently with the eye doctor. Okay,
Yeah,
because it
sure.
can distort the shape of your eye. It can affect your vision and start to say some of the complication. Okay,
Sure.
yeah. The,
Sure.
the
Thank you.
problem that you might find is if it's posterior uveitis, then I just say inflammation of one of your coats of your eye, because the eye is having three coats. Okay, the outer coat, the middle coat, the inner coat. So if you feel that it's posterior uveitis or optic neuritis, then tell him this is inflammation and the swelling of the nerve of the back of your eye. That can be okay. And how you would suspect optic neuritis, say pain coming with acute painful eye, how you would suspect optic neuritis. It's just came, you know, with the
One thing is
discussion.
pain, and another thing is the red color dissociation.
Yeah, excellent, and especially with the eye movement as well, the pin with the eye
Yeah.
movement. Okay, so because I think in one of, I think the blue book,
MS
Dr.
case, yeah.
Emily book, having multiple MS case coming with optic neuritis. So yeah.
Yes.
So all of this, you know, eye can be, you know, eye and the skin can be connected with a systemic disease. So there is, you know, in the internal medicine, there is chapters. Well, a systemic disease presenting with eye symptoms and systemic disease presenting with the skin symptoms. So it can be connected. So just keep, you know, keep your, you know, your brain open, okay, and be open-minded that these can be connected together. Okay, and then we'll be connected with the psychosocial. So, vision, driving, okay, or urgent referral. What about transient residents? So these are the things that I would, you know, think of it in such cases. Yeah. Anything else?
Not from my side.
Okay, so let's stop the recording.